I think have this belief that like a healthy community equals like healthy people. And so for me, pharmacists being able to take this like holistic approach that recognizes, there's all these factors or determinants that affect people's ability to achieve health, and collaborating with like other community partners or disciplines to support people's health in the community, like that is really, what I enjoy most.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional healthcare careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. Today, we have special guest Dr. Sarah Schneider, who is a licensed pharmacist and current postdoctoral fellow in public health at the University of Pittsburgh. After completing her PharmD through Duquesne University's unique weekend program in 2019, she worked internationally for a non-governmental organization before electing to continue her education by obtaining her master's in public health. In this episode, we will have the opportunity to learn more about the amazing opportunities pharmacists have to get involved in public and global health. Let's get into it. Hey, Sarah, welcome to the podcast today.
Hi. Thanks for having me.
Yeah, super excited to explore this unique perspective in pharmacy and obviously global health. So let's take things back to the beginning. Can you tell us a little bit about yourself and where you're from?
Yeah, so I actually grew up here in Pittsburgh. I did my bachelor's degree at Edinburgh University up by Erie in biochem, then came back to Pittsburgh, started working in a pharmacy, applied to pharmacy school to Duquesne's weekend pathway. That took 4 years, and then went to Belize to work for a nonprofit outpatient clinic, and came back, started working for a community pharmacy during COVID, and decided to go back and get my MPH at the University of Pittsburgh, finished that up in May of 2022, then went to Kenya for a couple months to work at a hospital and precept pharmacy students from the States, came back in December, and then applied for postgraduate training and started my pharmacy public health fellowship at the University of Pittsburgh in July of last year.
Wow, so that's incredible. So you've obviously had a very robust career and throughout this. So I'm interested in exploring a little bit more about like what prompted you to go to pharmacy school in the first place?
Well, I knew I was always interested in medicine. When I was like an undergrad student, I thought about like medical school. I think I did some shadowing and just didn't feel like the right vibe for me. But I really liked the medication side of it, and then I started working in a pharmacy after I graduated. And that's when I started exploring, pharmacy, and realized that there was, way more pharmacists can do than just dispense medications, more clinical roles that pharmacists can have. And that's when I started exploring, the weekend program at Duquesne.
So when you were working in the pharmacy, were you in like a community pharmacy at that point, or was it a different type? Yeah, so
it was like a giant eagle. Like I was working as like a technician. Yeah.
Interesting. So like, did you take that job with the ambition of pursuing pharmacy at that point? Or was it more so that you started working as a technician because there was an opportunity, and then you thought to yourself, wow, this is fascinating. Like I need to become a pharmacist.
Yeah, I think I just kind of got the job because I was just trying to find something, to make some money. I was living at home. I think the first job I got after I moved back home was actually at Victoria's Secret. And so I was like, I need like something like relatively related to biochemistry.
Wow.
That's how that happened.
Well, that's awesome. So then when you were looking for pharmacy schools, what were like the perks of pursuing Duquesne's very unique weekend program? And at the time, I don't think there were very many programs that were offering what they do.
Yeah, I mean, I knew Duquesne had a good program. I heard, previously from people that it was a good program. I also looked at Pitt, but I think ultimately what swayed me to Duquesne was the ability for me to work during the week. I was planning on saving up money to move out of my parents' house, prior to starting, pharmacy school. And I knew I needed to be able to, have some income while going to school. So that allowed me to work. I want to say I probably worked an average of like 30, 35 hours a week. and then went to school, Saturday and Sunday all day. It was like 8 hours. And we had like, the way it was set up was like, it was all year round. And it was essentially like one class at a time. So you would have like every Saturday morning, you'd have a class, or an exam. And then you would stay and go to class the rest of that day and Sunday. And that went on for 3 years, year round. And then the fourth year was like clinicals.
Interesting. Yeah, and I'm obviously biased because I went to Duquesne, but I was part of the quote unquote traditional style program. But we always would come across like the different weekend students, and I can't imagine having to work a 40-hour work week and then going and doing all that pharmacy content that we were expected to get done in like a 5-day period of time, and you were doing it in 2 days. So kudos to you for tackling that. And, is this an opportunity that's still available to students now, or has it kind of adapted with the times, especially since things have gone a lot more, technology based?
Yeah, they announced my last year of school that they were kind of phasing out the weekend program. They were converting it to an online program to be more competitive with other online pharmacy programs. So I don't know much about their online program now, but, in some ways, I'm glad I did the weekend program, opposed to an online program. I think I liked going in and having the in-person experience. But, it was also challenging too with time management.
Of course. And so with that in mind, were you ever, as you were progressing through, like you obviously like the clinical hands-on perspective, did you ever consider like pharmacy residencies, or what was like your career outlook at that point?
Yeah, when I was in pharmacy school, so I worked at Duquesne's pharmacy in the Hill District, which is no longer there, but I knew even before going to pharmacy school that I, was really passionate about underserved areas, and underserved care and global health. And so I actually wanted to do an Indian Health Service residency. I applied to some of those, had some interviews, but I didn't match. And then kind of thought about maybe going into the second round of the ASHP match. But there wasn't any programs that really had what I was looking for, and wasn't really sure like what to do next. I was actually on a rotation with a Pitt professor. It was my very last rotation at Birmingham Clinic. And one of the professors just got back from Africa. And I was like, oh my gosh, like that's what I want to do. And she just happened to know of this clinic in Belize. And we pulled it up, and they were looking for a long-term pharmacist for a year. And she just encouraged me to apply, and, it kind of worked out.
Yeah, absolutely. It's really cool that you pivoted too, where you took like, what was at that point in time a very difficult residency to get into. Like I know that IHA is very competitive, and it obviously didn't turn out how you wanted it to, but you didn't give up on your dream of like working with underserved populations and found this other unique opportunity. So that's really cool that you were able to explore that too. And so with that in mind, like you had an interest in going and serving in Belize. How did like the logistics of that work out? Like, did you have to get licensed here in the US or like get licensed over in Belize? I'm not sure how that works exactly.
Yeah, both actually. So, I, I literally like took my NAPLEX, that summer, and it was like 2 weeks after I passed my law exam. I think it was when I left for Belize. And then I used my, license and everything to apply for licensure in Belize. So I had to like submit all that documentation. So
Wow.
it happened super fast. Yeah.
Wow. And, as a new grad, that's definitely got to be like kind of overwhelming to some degree to kind of like make this massive jump. Like all of your peers are going and working in like the community pharmacies around the corner, and you're going international at this point. So I think,
Mhm.
kudos to you again for taking this like massive step. And so with this opportunity, can you tell us a little bit more about like what your experience was like while you were down in Belize?
Yeah. So my title was, I was like assistant pharmacy director. They transitioned that year into having the Belizean pharmacist be the pharmacy director. He was like kind of being, mentored into that role. And so it was nice for me because I got to kind of step in as, a new grad as like assistant and not have like a direct leadership role. But my job was precepting pharmacy students from the US on their API rotation. So we had about like 5 or 6 different universities that had an elective experience there. And this clinic, Hillside Healthcare International, and they still accept pharmacy students if anyone's interested, but they actually accept PA students, medical students, nursing students, PT students. So they accept all these different disciplines on rotation. And it's like a very like integrative health experience, I think, for students. You know, they get to work on an interdisciplinary team and collaborate with all these other professionals and kind of understand kind of this holistic approach to care. And the clinic is open like Monday through Friday. And then they also have mobile units that go out to like the Mayan villages. When I was there, they were going out every day pretty much. Now, because of COVID, they stepped back quite a bit. They're only going out maybe once or twice a week, but that was like the other experience that they had. And then they also got to do some home health stuff and other like community health experiences as well.
Wow. I think that's fascinating. And, you know, all the students listening in should definitely consider like an opportunity, you know, whether or not at this particular institution or just like all over the place. I went to Haiti when I was in pharmacy school. I'm not sure if you remember, but they had that Duquesne Haiti trip. And that was like paramount to my kind of decision making of pursuing medicine in the first place. So that kind of was the spark that led me down this pathway. You know, to obviously becoming a physician. And so, you know, just the different exposure and the perspectives you see and like kind of the appreciation for, you know, how much we have here in the US, like it was just a very eye-opening experience. And I think, you know, everyone should kind of go down there and see some of that different stuff. And obviously the impact you have on all the people down there that you serve. So that's
Right.
incredible that you're able to do that. So what kind of impact can a pharmacist have in providing medical care in a public health setting, especially in an international space?
Yeah, that's a great question. I think pharmacists can have a huge impact. Obviously, any sort of medication related needs. So especially in global health settings, you know, medical service trips and things like that, they need like that medication expert on staff to be able to not just ensure, you know, proper storage and safety of medications, but also, you know, like when I was in Belize, we had very limited medication supply. Sometimes you know, it was very challenging to procure medications and consistently. So the medical staff really relied on us to provide recommendations for like alternative treatment. And we called it like MacGyver medicine, where like sometimes you're using medications off label or in different ways, because we understand how medications work. So for example, you're familiar with like Debrox, you know, that we put in the ear to clean out the earwax, right? We didn't have that in Belize, but you can actually use Docusate, the stool softener. So what you can do is poke a hole in Docusate capsules, squeeze it in the ear, leave that in for like 5 minutes, and then irrigate and get that earwax out. So like, I think our expertise in medications allow us to kind of think about them in other ways and utilize them to treat patients that medical professionals may not always think about.
That's interesting. Yeah. Like you kind of have to operate on the fringes of like your clinical knowledge too, where you're like, well, these are all the resources we have right now, and this patient is in need. What can we do to kind of overcome this challenge? And so that's really cool. And I didn't know that you could utilize that. Definitely some MacGyver medicine.
Yeah. And then especially with antibiotics too, you know, we were limited sometimes on what antibiotics we could get in. And, you know, we were always very, cognizant about like resistance and stuff like that, you know, making sure like the antibiotic, because sometimes the students or the, doctors who were there wanted to just kind of throw whatever antibiotic we had at that patient. But, you know, that can be a little bit risky, you know, for resistance. So we are always like making sure that like the antibiotics are being used appropriately, and trying to find, through like clinical resources, like data that supports using this antibiotic as like a second or third line option, instead of just like, this is all we have, so we're just going to throw it at them and hope it works kind of thing, you know?
Some good old antimicrobial stewardship right there.
Yes.
Wow, so that's fascinating. And so this organization that you were part of, like, was it a massive like conglomerate, or was it like more of a smaller, close-knit group where you mentioned this interdisciplinary team? Did you feel like you were like kind of hands, together for that entire process?
Yeah, it was definitely a lot smaller of an organization compared to when I was in Kenya. Um, and I feel like everyone worked really well together. The majority of the people they actually employ are Belizean too, which is really great. I think that that's how it should be. Whenever Hillside originally started, the majority of the people were American, and they've just kind of like over the years tried to make the number of Americans smaller and the number of Belizeans bigger. But sometimes you can't find, a Belizean physician that will work there, or physical therapist or something like that. So the Belizean pharmacist that works there now, they actually help pay for him to go to pharmacy school in Belize. So like they're trying to have more Belizeans in like clinical roles as well. And just kind of, I don't want to say like phase out Americans completely. Like there's still some role, but create more sustainability. Yeah.
And so, throughout this process, it was obviously a very like unique experience. What do you think was like the most rewarding part about being in Belize?
For me, I think it was just what I learned about how to provide care and understand the needs of a community. I think when I went down there, I, was very naive and young and was just like so ready to like make an impact and stuff. And I think it was a great learning experience for me because I had to learn how to, take a step back and really understand, what the needs of the community are, understand the culture, all of these things. Cause I had so many ideas, that I was like, oh, we should do this, we should do that. And the Belizean pharmacist was like, well, that's not really going to work because whatever, this and that. Because I didn't have a good understanding of the culture and what the needs were. So I think for me, that stuck with me moving forward in all the underserved work I've done since then. And I always kind of, when moving into a new position, like take a beat for a while and just kind of listen and observe and figure out like, okay, what are the needs? How can I help, meet those needs in the way that they want me to meet those needs, essentially. So,
Of course, of course. And so after this experience too, you said you mentioned that, earlier on that you had only done it for about 9 months at this point, and then COVID struck. So,
mhm.
what was the process that went into like kind of ending that contract a little bit early, and what followed afterwards?
Well, the clinic just kind of pretty abruptly closed down during COVID because all the students had to go back. And they were actually closing the airports and everything. So like we literally found out like on like a Thursday that they were going to close the clinic down. And I was planning on sticking around for a little bit longer, hanging out, seeing some friends. And then like the next day we got an email from the embassy that they were like, we're shutting the airports down on Monday. Like you need to get out. So it was just very quick that it had to come back.
That's wild. And so when you got back to the States, obviously this is like the heat of COVID at this point. What was the next thing that followed for you? Did you go back to community pharmacy? And what ways did you try and stay involved in the, global health perspectives?
Well, yeah, at that point, I just needed to find a job, and so the first job I found was in like a community pharmacy setting, in an underserved area in Pittsburgh. And they actually hired me on to manage. So that was like kind of my first US pharmacist position, was like managing this pharmacy. And I think I was not really prepared for that, especially during a pandemic. That was like very challenging. And by the time the fall rolled around, I mean, I knew when I was in Belize, I wanted to go back and get my MPH. So I was like really thinking like this, I know I don't want to stay managing this pharmacy forever. I think this is a good time for me to cut back and pursue the MPH at this point, so I eventually just kind of pivoted, and I still worked like part-time, but then I ended up going full time to finish the MPH. Yeah.
Yeah, that's really interesting too. And like your prior experience in pharmacy school kind of already prepared you for this additional school at that point. And so where did you go for your MPH?
University of Pittsburgh.
So what has been like the greatest lesson from the MPH? Like what additional skills have you taken away from this program that you might not have learned in Belize?
So I feel like the MPH was a really great experience for me. It did like help me to understand, I think, more of the research side of public health, definitely the epidemiology side of public health. Prior to that, my experience with public health was really in Belize, kind of what I saw there. When you're in a low resource area, you really start to understand the importance of, prevention and health education and the impact that can make, especially when you're treating people, for the same infections like over and over again. So you start to be aware of like the need for public health. And so the MPH program for me kind of like put those two together, that understanding the need and like, how can I address the need?
Wow. And so after you had finished out your MPH, is that when you decided to go to Kenya as well? Or what kind of prompted you to go to Kenya instead of going back to Belize?
So I actually applied for a global health fellowship with Purdue University. And I didn't get the fellowship, but they still wanted to work with me. They, realized we had the same vision and values when it came to pharmacy and health equity, and wanted to kind of mentor me, really was what they did. They wanted to find a way to help me get to, because I did the MPH thinking like, okay, this is going to help take me to the next step in my career. And I kind of felt like postgraduate training was something else I needed to do. So they offered me a position to precept their pharmacy students at a hospital in Kenya. And part of that was with like AMPATH and stuff, which is a like huge organization. And they do a ton of work in Kenya and some other countries. And, but also through that experience, like they were just like mentoring me and helping me figure out my next steps, apply for other postgraduate training and stuff like that. So that's kind of how that came about.
And was it really cool to like precept with other students?
Yeah. So precepting in a global health setting is still my favorite. I have to say I've, precepted here in the States as part of this fellowship program. And, I think precepting global health students, it's really my favorite because they do grow so much. Especially in Kenya, it was like a 3-month, almost a 3-month, rotation that they were on. So they come down and, they're really timid and shy, and we're rounding on the inpatient ward, so it's really intimidating. Like I was intimidated too, because, inpatient is not really my expertise. And these patients were so sick. A lot of them had HIV and tuberculosis and, kidney disease, and, they were on dialysis, and it was just so intense. And, obviously the cultural shock too, that factors in. And so they definitely were very timid at first, not really saying anything. And then by the end, they were just so immersed in the culture and like making friends with all the Kenyan pharmacy students and going out with the Kenyan pharmacy students. And like during rounds, they really made themselves like a part of the team, so like the registrar, who's like the resident, would be like, okay, what's your recommendation? They would call out on the pharmacy students, because at that point, like they really built that trust with them. They were great students. And so it's just like so fun to kind of see them grow and understand, a different healthcare system and other cultures, and just really be forced out of their comfort zone in that way. So I think that is probably my favorite precepting that I've done.
And that's the beauty of it too, is they're going to be much better, healthcare professionals, like working with, different diverse populations, even when they come back to the States, or maybe they'll come back to Kenya or other, international opportunities. So hopefully they all caught the bug and they're ready to go.
Yeah.
And then after you had finished up your stint in Kenya, you obviously then began to pursue fellowship a second time around. Is that right? So where did that opportunity lead you?
So yeah, I actually came back and I was exploring both like residency and fellowship, some sort of like, I knew I needed to do postgraduate training, but I think for me at that point was like, what's the best postgraduate training? What am I trying to get out of postgraduate training? And I think for me, I already had quite a bit of experience coming into it. So it's like, what skills do I need to gain? And, how is that going to take me to the next level? And, ultimately for me, I think this fellowship program was the best fit because, I had quite a bit of clinical experience, but what I really wanted to build on was, research experience, like community-based research experience, how to build out and develop, pharmacy services and programs and implement that. I also wanted to have like an impact on, community health and public health. I love working one-on-one with patients, and I still would love a job where I can work one-on-one with patients. But it's important to me to have a job that I can have like a larger impact as well and really use both like my PharmD and my MPH. And so I don't feel like a residency would have been able to provide all those experiences, where like this 2-year fellowship program really, really gives me those experiences and those opportunities to kind of build on those skills.
So what is your day-to-day like as a postdoctoral fellow now that you're working at the University of Pittsburgh?
Yeah. So, my fellowship position, it's through the School of Pharmacy there. It's a pharmacy fellowship focused in public health.
Mm-hmm.
And really what I do is a lot of community-based research, that is mostly program and service like implementation and evaluation stuff. So we have, a pilot program right now for harm reduction in community pharmacy. My bigger fellowship project that we're applying for funding for right now is looking at community pharmacists providing social determinants of health screenings and referrals, which they're doing through PPCN pharmacy. And what I'm trying to figure out in my project is kind of the best practices for the referral and follow-up process. We also contract with the health department. So with the health department, we have, we are there for their tuberculosis clinic and fill medications for the STI clinic. But we also partner with them on research grants. So we had a NACHO grant that funded a test to treat program at a community pharmacy. So it's a lot of this community pharmacy research where we're trying to implement, programs and services that are going to have a larger like public health impact, essentially.
That's interesting. And so kind of using this experience and all this like learning that you've done in this position, what are your goals? Sure.
I don't really know exactly what position I'll end up with after this fellowship. I still have a year left, but ideally I want something where I can work one-on-one with patients, maybe about 50% of the time, and then 50% of the time, do this type of, program development or, research that has like a larger impact on the community health.
Great. Well, I can't wait to see where it takes you. And, kind of speaking on, public health and with that in mind, there's obviously this, and this is more of an abstract question, but there's obviously this new insidious, like, malady, if you want to call it that, is kind of plaguing healthcare as a whole. While COVID-19 was obviously an external threat, internally, professional burnout has been running rampant. So what ways can we better identify burnout, especially in the pharmacy community, before it even strikes?
Yeah, I was going to say, I think it's pretty easily identified, but for me, I think how we can treat it is, listening to pharmacists and, giving them like the best work-life balance possible, as well as for me, I think just having a positive work environment is the biggest thing. I think sometimes working in a community setting where the company doesn't really support you and how you're feeling, And they don't really stand behind you whenever you have these instances of, patients being belligerent or threatening or something like that. Like that contributes to it too. So, I think having a good work environment that like supports boundaries, and like your mental health. I think that's probably the best way, but I don't know if I really have the answer there. That's a tough one.
For sure. It's a trick question because I guess, if there was an answer, it would have been solved already.
Yeah.
But no, you're right. I think like the having a quality environment makes everything, especially with you for yourself. You've had experience in the community pharmacy. And then you've now had experience like internationally, but you've explored the things that interest you. And instead of being, perhaps like stuck in your, clinical or I guess community pharmacy role. And so, by exploring those things that interest you and like kind of force you to wake up every morning and, put a smile on your face like that, I think is also a huge factor too. So, individuals who are kind of feel like they're stuck in, a different position or stuck in the community pharmacy, they should, my recommendation, I guess, would be to explore the things that actually, force you to wake up every morning and like be excited about the day.
Yeah, I agree with that for sure. I mean, I think that they just need to find the right environment for them. I know a lot of community pharmacists have been like shifting out of community and going into specialty and stuff because they just feel like, they're not going to be able to find a healthy environment in community pharmacy. And I disagree with that. I think that you can. It's just that, you know, some of the larger companies need to kind of wake up and start listening to those pharmacists and, try and better understand like what it is that is so difficult, it's hard to work. I mean, 12 hours a day on your feet, never getting a break, and then on top of that, you have, you know, all these patients that are trying to get their medications and you can't keep up. And you know what I mean? I think just like the workflow in those larger pharmacies need to change quite a bit. You look at independent pharmacies and they don't really have the same issues that those chains do because they've adapted their workflow. And they've also really focused more on provided clinical services. All of the independent pharmacies, that I know, the people that work there really, really enjoy it. And they have a very different experience than when you talk to someone who works at, some of the chain pharmacies. So.
Of course. Yeah. And, interestingly too, like where do you think the profession of pharmacy is going as a whole? And how can we kind of avoid like this, dispensing role per se and shift into something a little more clinical?
Yeah. I mean, I think it is shifting into more clinical. And, some of that has to do with just because the lack of reimbursement for dispensing, there's a lot of pharmacies closing right now, and it's because they just can't stay open in a dispensing model alone. The reimbursement for drug dispensing is not enough. And a lot of times pharmacies are losing money. So there's been like, over 70 pharmacies that have closed in Pennsylvania just in the past few months.
Wow.
Yeah. So, a lot of independents have already shifted their model to provide more clinical services through, Medicaid contracts. And now, especially, we just got provider status for Medicaid. That's going to open up some doors too for us to be able to bill for services.
Alrighty. So we've obviously talked a lot about, the different opportunities and like your experience as a whole, but I'm curious to know, like, from what you've learned throughout this process, like what ways can pharmacists get more involved in public health?
My advice to like any, student who's interested in public health would be to first like figure out like what aspect of public health that they're really interested in. Is it more, in the community setting? Is it more in the like emergency preparedness setting? And then figure out like how they want to have an impact on public health. Do they want to do more boots on the ground work? Because you don't need to have like an MPH to have an impact in public health. You don't need to do research. You can, but I think that, there's tons of pharmacists that are working in communities that are having a positive impact on public health every day. And we saw that with, the COVID COVID vaccines and things like that. So I think people just need to kind of think about how they want to have an impact, and what they need to do to have that impact. Like, is it going to be, more research, or is it going to be more clinical one-on-one? Or is it going to be like a mix of both? That's kind of where I'm at with my career, is, having a little mix of both. So.
Awesome. Well, I'm looking forward to having a lot of the students explore some of those opportunities, and either obviously pharmacists too. I think everyone should have, exposure to public health, whether it's like you're saying, boots on the ground, or should, consider doing like the MPH so that they can understand the decisions and the research that goes into kind of making some of the, policies and recommendations that we have in society. So that's great.
Yeah, thanks.
So I guess you've had this robust career, and I'm curious to know then, what do you enjoy the most about being in public health?
Yeah. So what I really love about public health and global health is really, this community aspect of it. Um, I I think have this like overarching belief that like a healthy community equals like healthy people. And so for me, pharmacists being able to take this like holistic approach that recognizes, there's all these factors or determinants that affect people's ability to achieve health. And, collaborating with like other community partners or disciplines to support people's health in the community. Like, that is really, what I enjoy most about, public health, and working in, pharmacy in the community. So like, for example, like I read this article a couple months ago about like training hairdressers, in mental health first aid, because like in some communities and cultures, like people really like trust and confide in their hairdressers. So it's like that idea of like thinking outside of the box. How can we utilize people in the community to like better support people's health, whether, they're community health workers, or they work at, community-based organizations, churches, pharmacies, any of that. Like, I think for me, it's this like very collaborative, holistic approach to improving the health of the community. And, how can pharmacists contribute to that as well? Like, so that's, I think, my favorite thing about it.
Well, we are getting close to the end of the interview today, and I think it's time for the famous 3 questions. And these are the same 3 questions we ask every individual who comes on the podcast. So number 1, how do you maintain some semblance of a work-life balance in your demanding profession?
Well, I have 2 dogs that I adopted in October, and they have definitely helped give me that work-life balance. When I come home and I walk them, and they're, just really affectionate. I also just like, biking and hiking and hanging out with friends and family and stuff like that. Also just setting good boundaries is another thing.
And so question number 2, do you have any last minute recommendations to students or graduates who are interested in pursuing a career similar to your own?
The advice I give all students is just, definitely keeping an open mind to everything. And if you're really passionate about it, keep pursuing it, and don't be afraid to pivot, and adapt, and, don't give up, really. I mean, like I've told you from my story, like I applied for residency, didn't get that, ended up going to Belize, applied for a fellowship, didn't get that, went to Kenya, like I've been all over the place, and eventually led me back to this program, which I think is a good fit for me. And I still don't know 100% like where I'm going to end up when I'm done with this in a year. But I think that if you just kind of keep following that like internal compass, about like what you're passionate about, like it'll all work out.
Of course. Yeah, one door closes and the other one opens, so you never know what the opportunities lie ahead of you.
Yeah.
Alrighty. And then our final question, what are your personal, professional, or business-oriented goals that you would like to accomplish in the next 5 to 10 years?
Ooh, that's tough. I think for me, really professionally, I just want to find a position that gives me the right mix of individual patient care and the opportunity to have a larger impact in the community through, public health initiatives and programs and services. And I think I don't really know what that looks like right now. I don't know if that's going to be in academia. I don't know if that's going to be, working for like a federally qualified health center. I really don't know. So if I can find a job that has that nice mix for me, and is fulfilling, I would be happy with that.
I love it. I love it. Well, big things coming from you. I'm really excited to see where your career takes you.
Thanks.
Alrighty, so we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, pharmacy practice, or entrepreneurial topics, check out my website at www.physicianpharmacist.com. Before we let you go, Sarah, where can our listeners get in touch with you and learn more about you?
So I'm on LinkedIn. I also have a profile page on the University of Pittsburgh's website. So either of those have my email address or anything on it. Yeah.
Fantastic. And obviously, if anyone has any questions about, this unique opportunity to explore global and public health, then definitely reach out to Dr. Schneider. All righty. So thank you so much for being on the podcast today. I really do appreciate your time. I know you're extremely busy as a fellow right now, so I do appreciate it.
Thanks.
All righty. Take care.